Then the other thing I did want to briefly talk about is the development and the fact that we've stood up a specialist healthcare support centre for people who need to apply for exemptions. When we first went into this pandemic, it was always thought that we would need to provide exemptions for various people to do things that were important that weren't allowed for under our directions. The plan at that stage was there would be maybe 1 or 2 of these per day. And so I did them all personally myself because they were very important, because we know that providing exemptions results in a risk to the general Queensland population, and I am extremely risk averse, and I'm not going to ever do anything that puts the Queensland population at risk. So I took on that role of doing all of those exemptions myself. Once we got up to around 100 of those per day, I realised that was no longer feasible, although very, very important, just as important now as at the start of the pandemic. I believe that other people need to take on that role. So we've now stood up that team. There are 80 people in that team who are providing that support to look at every single request for an exemption. And we are now getting thousands per day because people are wanting to come to Queensland or to be exempt from some of those directions within Queensland. And every single one of those exemption requests is taken extremely seriously. There is one I would like to discuss specifically, and that's exemptions for funerals. Right at the start of this pandemic, that was one of the hardest things that I had to face, because we know that funerals are very, very high risk for transmission of the virus. So right at the start of this pandemic, the Australian Health Protection Principal Committee put forward a protocol for funerals. So initially, we only allowed 10 people to attend a funeral. I'm sure everyone remembers that. Then we expanded that to 20, and now in Queensland we allow 100 people, because we know how important it is that families and their friends can grieve together as a group. That is extremely important. But by doing that, we've introduced a significant risk. We know that, and most recently we've seen in Sydney several clusters related to funerals down there. So we know having 100 people at a funeral is a risk. And most recently, when we brought back those tightening of restrictions that people can only gather in groups of 10, limiting visitors to aged care facilities, disability care facilities and hospitals, and increasing use of PPE, we did not change the restrictions for funerals, knowing though that that is a risk. Now, one thing I've always felt that has kept Queensland safer, and we are able to continue to have that increased risk of 100 people at a funeral, is that I have always been very, very, very careful in making sure that anyone at a higher risk of having COVID-19 does not attend a funeral. So that those are people who come from hotspots, interstate, or of course anyone who comes from overseas. So although I understand the enormous toll this is taking on people who are coming here to Queensland to attend a funeral of a loved one, whether that be a relative or a friend, they can't do that until they've been in quarantine for 14 days. Because the last thing I would want to happen is to have an outbreak at a funeral, and by definition there are always older people attending funerals. They're the people we know will always attend funerals. So they're a very, very risky environment for spread of the virus because of the nature of the service and what happens, and secondly because of the people who tend to attend those funerals. So I do not want to see in Queensland any risk of people attending a funeral, getting exposed, getting COVID-19 and then going back to a vulnerable setting, because people are able to, one of the exemptions for leaving an aged care facility is to attend a funeral. So that would be terrible. We've now had several outbreaks in aged care facilities in Queensland that we've been able to control, thank goodness, because we've now seen that Australia's numbers who've died as a result of COVID-19 have reached over 700 Australians. And we know a lot of those have happened in the last month, and a lot of them have happened in aged care facilities. And that's something that I'm absolutely adamant that I will do everything I possibly can to stop happening in Queensland, because every single death is a really difficult death for someone, including me. I don't want to see Queenslanders dying from COVID-19 that I could have prevented. I can't prevent every single death, but those that I can prevent, I'm absolutely adamant, and I make no apologies, that I will do my best to prevent. Having said that, I also understand the awful situation for people who are coming into Queensland from interstate and from overseas that can't attend a funeral to mourn their loved one. So we do have some processes in place to try and help with that. So, of course, if they wish to and the funeral home can support it, and a large number have, then they can go and have a private farewell with their loved one in the funeral home. That can be done and has been done a number of times very safely due to the support of the funeral home, but they do need to wait 14 days before they can attend a funeral.